Basically, we knew that androgen deprivation therapy is a really important treatment for prostate cancer. But over the last few years, there have been a lot of concerning studies that have come out suggesting that androgen deprivation therapy might be associated with cardiovascular events and cardiovascular death. And this actually led to a warning from the FDA saying that there may be a linkage between androgen deprivation therapy and these bad events, and also to a joint statement by multiple medical societies stating that there might be a linkage. And this led to a lot of concern. I think this translated into the clinic where patients were getting concerned about whether they should be receiving androgen deprivation therapy, and doctors were getting concerned about this.
So we looked at this question with our primary endpoint being cardiovascular deaths, and we have not found in over 4,000 patients an excess cardiovascular risk. In fact, what we found a decrease in prostate cancer specific mortality and overall mortality with the use of androgen deprivation therapy in the form of LHRH agonist in our study. But I think now we can say that for the average patients, androgen deprivation therapy is safe from cardiovascular perspective. The only thing we could not do, the drawback, is that there are some subgroup analysis and multiple studies that showed perhaps the population that is the most vulnerable are the patients with prior cardiovascular morbidity, such as congestive heart failure and myocardial infarction. And in this, in our analysis, we could not stratify by these comorbidities. We expect overall that 10% or less of patients could have such prior history.
For the majority of men, androgen deprivation therapy, if you have unfavorable risk prostate cancer, is going to reduce your risk of dying from prostate cancer. It's going to reduce your risk of dying overall, and at least we didn't see any evidence that it's going to increase your risk of dying from cardiac causes.